Hello viewers, you're welcome once again to Wellbeing Call. Our talk today is about oral health. To floss or not to floss. So, we do so many things every day without necessarily giving it a second thought. So we eat, we talk, we smile, we laugh, we chew. We don't give it a second thought. And the health of our mouth has a lot to play in all these activities I just mentioned. Eating, chewing, swallowing, smiling, talking, laughing, singing. But there are certain other things that are connected to our oral health. And it might seem so, how on earth can this and that be connected? But guys, they are. And what it is how our oral health is connected with other systemic issues, other illnesses, other medical conditions. There are 3 oral conditions that have been connected to systemic diseases, systemic illnesses. And these have been done through various studies, but the evidence is still building in this area. The first one is dental caries. And this is where lactic acid is washing over our tooth enamel. So that's the white bit of our teeth that we can see. That's what the enamel is. And you can see that in this diagram here. And so lactic acid is produced when bacteria in the mouth breaks down certain carbohydrates. Those carbohydrate foods are usually heavy in sugars. So the breakdown product, lactic acid, when it remains in the mouth, now corrodes the white enamel of the teeth. And this is what leads to dental caries. So some of the symptoms or signs of dental caries is sensitivity. You start feeling like you have sensitivity when you drink cold drinks or hot drinks or eat something sweet. Another sign that you might see when you have dental caries is like a black or brown staining on your teeth. You might also see pits in the teeth itself. The second oral condition is called gingivitis. And it's when you experience redness and swelling in the gum. And there could be bleeding, especially when you go to brush your teeth. Sometimes the bleeding might happen when you're brushing and it might be painful, but sometimes it's not painful. So it's an inflammatory condition and it's caused by bacteria. The third one is periodontitis. Periodontitis happens when gingivitis is present and it's been left untreated, and it now progresses to further chronic inflammation in the gum, and the soft tissue in the gums begin to pull away from the teeth. So this is a much more serious condition because sometimes it affects the bone, the structure, even below the gum. This usually culminates in the loss of teeth. Some of the medical conditions that actually have a link to the health of our mouth are heart disease, pulmonary disease, which is disease of the lungs, pneumonia, bronchitis, and diabetes. So there's growing evidence of these things. And of course, there is no logical link, when you just think of it on the surface. There's no immediate link. But one of the key things that researchers have found is that with inflammation and infection in the gum, when left untreated, it becomes chronic infection and the inflammation is chronic. So when the infection progresses to the point where soft tissue, the gum, is beginning to pull away from the teeth because of the activity of bacteria on the gum, then that condition has progressed to periodontitis, like I said before. So with periodontitis, there will now be pockets of bacterial growth in the spaces that have been created by the soft tissue pulling away from the teeth. And this now leads to further degradation of the tissue at the root of the teeth. And sometimes the bone at the base of the teeth, at the base of the gum and the teeth, is ultimately affected. So this is chronic ongoing infection. Sometimes the infection becomes systemic because the vessels at the base of the gum now also become eroded. So 3 key things happening here: chronic inflammation, deep-seated infection, and damage to vascular structures are what researchers have found that culminates in heart disease or cardiovascular disease and bronchitis and pneumonia. And because of damage to vascular structure, diabetes as well. But prevention, as we know, is always better than cure. So the preventive measures are, first, to make sure that you keep your dental appointments. Do your regular dental checks. And this is where your dentist will be able to find out, first off, whether there is underlying issues already that you don't even have symptoms of. So perhaps you are not aware that you're having redness to your gums, to the base of your teeth. Your dentist will be able to tell you, and you can immediately just stop infection in its tracks. Secondly is to, of course, follow your dentist's prescription. So the general recommendation is brush twice a day for 2 minutes in the morning and before you go to bed. And to that, I would also add that it's it's good practice that after each meal that you rinse out your mouth. So you probably won't be rinsing out every fragment of food, every bit of food, but you would rinse out a good amount. Or if you're not somewhere where you can rinse your mouth, drink water. Again, that would help to reduce the bacterial load in the mouth. And thirdly is flossing. This is one activity that probably a lot of people do not do. And some even say there isn't actually enough evidence to show that it has any effect whatsoever. But I'm just going to explain this away quite logically. If we believe that we should clean our mouth every day and twice a day at that, then by the same logic, it's important to floss. Because any ordinary toothbrush, normal toothbrush, even sometimes the electric ones, will not necessarily get in between the teeth where there could be food bits lodging, and so you're not able to get to it with the use of an ordinary toothbrush. And this is where flossing then comes in, because that's what flossing is going to achieve. So speak to your dentist, because with flossing, it's important to do it right so that you're not actually doing damage to your gum. So you need to floss correctly so that you're not damaging your gum. Quite frankly, flossing might not come easy at first. A lot of people find it tricky to do, especially getting to the corners, to the back teeth. But just persist, because you can do it. Persist, keep trying, and you would eventually get to do it, and it will become a habit. And it's a very necessary habit, because over time, not flossing would mean there is a build-up of bacteria. Some people notice it quite quickly and fairly easily when they get bad breath. Then they know, okay, there is a build-up of unwanted bacteria in their mouth, and then they do something about it. But you don't have to wait until then. So just persist, and you will get a hang of it. And on the long run, you would be reducing your possibility or probability of suffering from heart disease as a result of bad mouth hygiene, or diabetes as a result of bad mouth hygiene, or pulmonary disease. And who knows, further down the line, researchers might find that actually the health of our mouth is linked to far more than we actually think. So stay well, everybody. Keep up with the oral hygiene. Keep up with your general health. Keep up with your mental health. And please share this video. Please subscribe and take care. See you in the next video. Bye-bye.